Good afternoon, everyone. It's Dr. Gershon with another Endeavor Better Health webinar. And I am absolutely thrilled to be here today with Dr. Harvey Castro, a colleague, both in medicine as well as in business. Dr. Castro really represents an incredible combination of skill sets, and he'll tell you about himself. But first, I want to just say that Dr. Castro represents a very different type of guest on the Endeavor Better Health series. As we bring an open source platform to everyone in the healthcare industry, we have yet really to bring on a clinician who's in the trenches. And that's how Dr. Castro really sits today. He is a person with many talents, but both he and I have been in the emergency room, in the trenches. We know what it's like to make decisions. We know what it's like to work 14-hour shifts repetitively. We know what it's like to work with other healthcare professionals who are on the verge of being burnt out or being flooded with patients in an emergency room where there's noise and chaos. We're framing this in the trenches episode into a very narrow lens, which is part of Dr. Castro's expertise for many years. He's written quite a number of books on AI. This episode is really about how is AI reshaping medicine for the clinician? What are the headwinds and the tailwinds for practicing physicians as AI begins to get rolled out? And this has very meaningful impact on investment decisions, both at the enterprise level and at the institutional and corporate venture level. It also has implications for the entrepreneur founder who's looking to develop products and services that clinicians can. Without further ado, let me change the screen here, bring you up close and personal to Dr. Castro. And Harvey, welcome, first of all, to an exciting 45 minutes together. I want to say, first and foremost, it's a pleasure to welcome you to the community. You've done so much for physicians and for patients. And also, I want to take the opportunity, as I always do, to thank everyone for signing in today. We really could not be where we are as a platform without this incredible support. We've now hit over 1.4 million views. And I think that the new partnerships that we have now with organizations like Biospace, where we're bringing information about what's happening on the investor side, the entrepreneur side, and now on the clinician side, I think is going to be more and more front and center to everyone's in the Biospace platform, which covers a broad range of geographies as well as in healthcare, to bring an awareness of partnering, collaboration, and the skill sets that are necessary in this new digital age. So with that, I want to really welcome you, Harvey. Please, can you tell us a little bit about yourself and then a little bit about, I think, your kind of day-to-day life. And then I have a few questions to ask about what is it like kind of questions.
Yeah. So first of all, thank you so much for having me. I love watching your show. I love what you do. In every business, we need the entrepreneurs, the people that dream, but we also need to be able to fund our dreams. And if those dreams are not funded, then they kind of lack being a reality. So I'm glad to see that you're on both sides of that, obviously innovating and then obviously with helping with these venture funds and analyzing. So thank you for all what you do. A little bit about me. I'm originally from New York City. I'm not gonna go way back, but I was in the U.S. Army, and that got me to Dallas, Texas. And since then, I'm a board certified emergency physician, and I kind of describe myself as this nutty professor kind of person. Anything that I'm passionate about, I really just go all in. And because of that, I came across ChatGPT about a year ago. I was literally playing with it. And when I was playing with ChatGPT, I thought, holy cow, this is going to help medicine in so many ways. And so I literally wrote the first book out there on ChatGPT and healthcare. And since then, my day-to-day has been quite fun. I do a little bit of everything. I consult for a couple of telemedicine companies. I also consult a couple of startups in AI and healthcare and how to use AI. And then I'm also doing a little bit of PSA, public service announcements. I'm able to work with the Spanish TV stations and NBC and Fox News and do a lot of reports on AI and healthcare. But then I'm also working with clinicians around, literally around the world, on how to use ChatGPT or any type of AI in their circles, in the clinics. But then at the same time, I'm also advocating patients on how to do it safely. So it's a little bit of Nutty Professor, a little bit of a lot, but it's really exciting.
Well, first of all, you've written quite extensively. You have both, I think, a real world experience, focus, and platform as an emergency room physician. You know what it's like in a day to day basis. And now you have exposure to really, of the moment contemporary physicians coming up from medical training. I have seen some incredible shifts. I am a professor at a number of different universities like yourself, and I'm very involved with the medical education part of medicine. Certainly, virtual reality is a completely new and exciting area in medicine, and AI and the integration of AI in educational programs is going to be terribly exciting. But I really want to focus this conversation on the here and now for practicing physicians. What is it that you see in your conversations with physicians in clinics and in some of the companies that are servicing the needs of the clinicians as headwinds and as tailwinds? To adopt, the new technology requires a mindset. And, you know, physicians are many things. Quick adopters is not one of them. So perhaps we could talk about the mindset of physicians and what are they saying about the actual implication, the use cases in the here and now, and might extend that out to a few years from now.
Yeah, no, great question. So I see physicians, AI in healthcare, and healthcare professionals as follows. I really see it as a bell curve. We have some early adopters, we have some that are late adopters. And I hate to generalize, but I really feel, and based on my experience and talking to different people in the workforce and age groups, I am finding this sweet spot of people that have at least 5 to 10 years after residency as really wanting this technology. And some of the newer doctors don't have the clinical gestalt or experience to say, I don't know if ChatGPT is hallucinating. I really don't know. And then I have some physicians that are maybe 20, 30 years out that are like, I want nothing to do with AI. Like, if you're going to force that upon me, I'm going to retire early. So it's really interesting to see the extremes. But simultaneously, what doctors are saying, um, it's quite interesting. As an entrepreneur, you can create the magic bullet, the amazing limousine, but if the healthcare provider says that's too many clicks, that's not for me, or that's not really going to save me time, that's not what I want, they won't use it. And so a lot of the stuff I'm doing is literally just spending time in the trenches with the doctors and saying, okay, do you like this interface or not? You and I are biased in that we've been in the trenches. We know what we want, what we don't want. And so it's a lot easier to come up with those solutions or come up with those interfaces or look at what parts of medicine would help. I love that you're an ER doctor, and I know you can relate. For me personally, 2, 3 in the morning, I'm not at my best. I'm exhausted. I'm tired. And so, some of the pros that I'm seeing is just being able to use some AI, ChatGPT, or Google Gemini will be coming out soon, and that'll be another one. But the skinny is, as you know, we have patients that come in, we're tired. It'd be nice to just be able to say, okay, my 24-year-old comes in with XYZ. These are the tests. Here's my differential. What else should I be thinking? And for it to come up with a list of things. Because again, if I'm fatigued, I'm tired. And if it says, oh, did you rule out XYZ? Then I'm like, you know what? Thank you. Because I'm not thinking. I need to go back in the room, maybe add a test, maybe just ask a couple of questions. And that's like, I feel like the biggest use is like right now. Another thing from an emergency point of view, I used to work right by the airport, and anyone that got sick at the Dallas Fort Worth airport would always come to our hospital. We were the closest hospital. And the reason I like sharing this example is some of the things that were in my electronic medical record, I couldn't use their language because it didn't exist. And so now I'm able to go cross-reference and look at something like ChatGPT and say, wow, they have, over 80 languages. Hey, they happen to have this language. Now I can put it in there. Now I can communicate with the patient. So that's another positive. Whereas before, I would have to get on the language line, hope that they had that language, hope that translator was good enough. But now I can translate. And when I teach doctors this, I'm like, hey, don't just stop there. Take advantage of this AI. If it's been trained on different cultures, then say, hey, from a culturally sensitive way, let's ask this patient in Latin America how XYZ, as opposed to in the United States, we use US examples. Why not use, if the person's literally from Latin America, use Latin American examples. That way they're like, wow, I kind of get what he's trying to say.
Now, those are some very kind of real practical use cases. I want to shift a little bit towards some of the things that doctors use that are supplied to them. So part of what AI offers is increased predictive value for pathology, for imaging, for medical record keeping, um, codifying information in a very timely fashion, in a more precise fashion. What is your feeling right now about the integration of some of these diagnostic services and record keeping services? Do you see it easily integrating into hospital systems, into large clinical practice? And how soon do you think that's going to happen?
I see it as two flavors. When we talk about AI in radiology, we know we all are seeing studies that they're diagnosing lung cancer 10 years before, or they're able to catch breast cancer way before it actually happens. And so those type of algorithms, I think we're going to start seeing them more and more in radiology, just because it's just more rampant and it's getting FDA approved. The harder part is going to be the stuff that you're saying, like the predictive analytics, because of the data and how the data presents. For example, if you and I are from New York, if we did our data set in New York and we're like, hey, we got the best predictive analytics here from New York, and then let's say I'm in Dallas, Texas today, or that's where I live, and I use that same algorithm here in Dallas, it may not apply at all because we have two different populations. And so to answer your question, what's going to come in the future, there's this thing called federated learning. And all that means is that we're using our hospital data, and my hospital is probably different from yours, but we're using it to train our algorithms. But I don't have to let go of my data. I can keep it inside and still train it. But then I'm helping you train your model and you're training, helping mine. But then when it comes to actually the predictive analytics portion, that's what we're talking about, it's coming from my hospital. And as a clinician, you know very well as an ER doctor, how nice would it be to say, okay, this one needs to be admitted, this one can go home, but having more than just these medical calculators that are out there that says, based on, heart score or this, we're going to do this procedure. Now we can start using the data from that hospital, from that population, to help us determine, should we keep this patient or should we send them home?
That's just such great real world information. Now, let me switch a little bit also now to enterprises large organizations that supply software. I mean, these are really the pivotal partners. And so one of the core investment themes, getting back to what you said originally, investment and liquidity is the fuel for the engine. From an Endeavor perspective, we look at early stage companies, pre-seed, seed, and A, and we pound the table really to
Um, I think you may have froze. The last thing I heard was we pound the table and then you're frozen. Okay, there you go. Now you're back.
the digital landscape really now is one that gives physicians an incredible opportunity to actually to recognize that there's more time to do the things that human beings do well, which is talk to each other, develop relationships, collaboration, and partnership. And so we encourage the CEO entrepreneurs to recognize, while incredibly important, stands a second to the number one important skill, which is bringing your judgment, your ability to connect with another person, your ability and build that information into what enterprises need and what hospitals need. From our perspective, we want to build companies that solve problems and recognize that integrating innovation into a hospital is not easy. It takes a lot of effort. The same thing in a large enterprise. So I'd like you to comment about what you see at hospitals. Hospitals generally are relatively slow moving in order to pick up new innovation, because when they pick up new innovation, it's hospital wide and system wide, and these are multi-year commitments. So there's caution. How do you see hospital on executives integrating with entrepreneurs and founders in this regard?
That's a tough one. Part of it, I feel like it's creating FOMO, fear of missing out, where, Hospital A has some parts of AI. I'll give you a real example. One of my ER friends uses, I'm going blank on the name of the company, but basically it's just AI that if somebody comes in with stroke-like symptoms, the minute the patient gets CAT scan, those images go and AI is reading them, and then can text the doctor and the radiologist saying, hey, this looks like it's a stroke. And then it pushes that to the radiologist to look at it quicker. But then simultaneously, the doctor's like, hey, AI is saying this is a stroke. Let's go ahead and get everything ready and get the official word from the radiologist. And so in that example, this would be great. It saves lives. It can you may be able to do the thrombolytics a lot faster, or do things quicker because of this. But it created some FOMO. Now, if there's a hospital across the street that doesn't have it, those administrators are going to say, whoa, we need to have this. The other thing that I look at this is on the legal side. Right now, everything's so new. Nobody knows, should we do this? Should we do that? But in the near future, I'm going to start seeing a world that there's certain types of AI that will become the standard of care. And when that starts happening, we're going to start seeing mass adoption in that particular field, because it's now become what's called a standard of care. And you and I know that what the standard of care in New York may be different from the standard of care in Dallas. So it's going to be quite interesting, because AI is moving at an exponential rate. Our hospitals may move at a logarithmic rate. And the more the gap increases between those two technologies, the more there'll be that demand for these things to happen. And that's when our administrators are going to say, whoa, the gap's getting way too fast. We need to lower that gap and do something about it. And I think that's perfect timing for entrepreneurs to be able to jump in and relate these services. The last thing I want to talk about, this other option I want to make sure I mention, is you can have the best AI models, but unfortunately, if insurance companies are not going to pay for it, depending on what you're doing, it may be great, but unfortunately, insurance may not pay for it. And the hospitals may be like, this is not adding any money to us or saving us money, so we're not going to take it.
Such great points, very practical. As you know, my background was as an FDA attorney, but I also worked for CMS. So I have a deep understanding and subject matter expertise, not only of clinical trials and regulatory affairs, but also pricing and reimbursement. It is absolutely unique. The US medical system is like no other in the world in terms of the complexity, multi-layered problems to have to navigate through in order to get reimbursed. I think you're spot on when you talk about these real life problems. I think also I want to talk about some real life successes. I'm a very, glass half full person. So let me tell you a story about Cosmo. Cosmo was a medical device company with a traditional endoscope, and they were using it for detection of colon cancer. They joined a AI component onto the device and blew the predictive value from 74% to 93%. Key in this story is the partnership that they created early on as an early stage company with Medtronic. Again, circling back to the raison d'etre of the Endeavor Better Health webinar, it's about collaboration. It is my personal belief that it's never too early to look at partnerships. Many of the early stage company entrepreneurs, CEO, have a concern that if they approach either enterprise, large organizations, or government too early, that they're going to damage themselves. And this is just not really the case. So Cosmo worked with Medtronic for approximately 3 years. They commercialized this product. They drew from that collaboration what is critical for me, which I'd love for you to comment on, which is the working relationship between early stage companies with innovation, large companies, and the data that they can pull together from projects. And so ultimately, it was the data that solidified an exclusive licensing arrangement between Cosmo and Medtronic. And that, in my opinion, will change the standard of care. I think it will be malpractice in 5 years not to use an AI assisted endoscope for colon screening. So I'd like for you to talk about this, which is a combination of the here and now. Cosmo is unique out of the box in terms of bringing this to a major medical device player, but also into, again, the user, the end user of these products. Will physicians look at Cosmo as a game changer? Will they look at it as an obstacle or a competitive threat? How do you see all this folding into the department level decision making?
The one thing I can say that we all share as healthcare professionals out there is we all want what's best for the patient. You wouldn't be going into medicine because you wanted to get rich. Your heart really is giving back to others. And I have a hard time believing that physicians wouldn't want a tool that may save lives, that may make their job easier, that will change the quality of someone's life. So in that sense, I think it's right on. I don't see physicians fighting it. One of the things I always talk about that I think what your story is it kind of dissects to is I always say the best thing is to always work backwards. So if you know where you're headed, then they're able to get that data, analyze it, and then be able to work towards this, which I think is what you guys are doing with that example. I thought is great. And so how to move this forward? I think big picture, yes, doctors will adapt. I think I agree with you. If there's some things in AI that if you don't do, it's going to be malpractice. Will it be 5 years? It may be sooner actually, because all it takes is one case for some lawyer to say, "Hey, you didn't use this device, and you had the opportunity, and you said you don't want to spend the money. My client now has cancer, now died or something." And all of a sudden, that one case may overnight it's standard of care. Now everybody's buying the that particular vertical.
Yeah. No, I think, again, everything that you're saying is really very, very pertinent. It's a combination of a number of different things. And certainly physicians, do go into medicine to be altruistic, do no harm, but also help patients. I think the key thing is we spend so many years learning and training a specific paradigm. It's ingrained to us. In fact, very much the old school philosophy is, work the interns and residents until they can't think anymore, just so that everything becomes rote.
Mm-hmm.
So that mindset, I think, unfortunately, is a double-edged sword. Yes, someone comes in grabbing their chest, you're not thinking that they have, a twisted ankle. I mean, there are certain things that immediately bring to mind, the top three problems and the three solutions instantaneously because you've seen hundreds of them.
Mm-hmm.
At the same time, that creates somewhat of a structured thinking pathway. It doesn't leave room for that creative, indecisive vision. And so, and which is good. You want decisively, you want to act with known, proven standards of care because you know those things work. But now we're in an era of exploration. And the truth is that AI is a very much it's been around for decades, but it's an unproven technology on a day-to-day clinical basis. And so I don't think it's unreasonable for physicians to take a wait and see approach for some aspects of AI. But endoscopy, for example, there's techniques that you have scope that you've been using perhaps for 20 years, which now you have to relearn all those paradigms. You have to relearn all that thought process because many of these technologies and the Cosmo endoscope, for example, you do not have to see the lesion.
Wow.
The AI is so powerful that it will direct the endoscope to an unseen lesion. So these lesions can be as small as 1 millimeter.
Amazing.
Yeah. And so this is, I think, an understandable contradiction in education. And so where I'm going with this is I think that there's a top down and a bottom up change. The top down is education. So at the highest level, deans of the schools of public health, deans of the schools of medicine, deans of the schools of nursing, they'll have to come together to begin an educational program about what the capabilities are, both the strengths and the weaknesses, the limitations and the possibilities, to encourage this creative mindset. And then second, from the bottom up at the grassroots level, people in different departments who are thought leaders have to be early adapters and
Yeah.
early adopters and pick this technology up and try it. And they can try it in a structured way that everyone's comfortable with, but they need to set a certain standard of curiosity that I think, will move the needle. And in this process comes a self-educating comfort level. And I think physicians like to feel comfortable about their decision-making process. They like to feel that the medical association is behind them. They like to feel that textbooks are behind them, that their colleagues are doing what they're doing. And so I'd love your opinion, because you are involved in education. You are a professor at one of the universities in Texas. How do you see the educational programs taking on this role?
Yeah, unfortunately, physicians and healthcare don't adapt that quickly. In education, you would think they adapt quickly, but when it comes to AI, there's so much resistance, and I'm like lost for words. Yesterday I was literally with my 14-year-old daughter teaching her AI, how to use AI, how to be better at school, because I feel like these are the tools that she needs to learn, because fast forward, by the time she's out in the workforce, if she doesn't know how to do this really well, she's going to be behind. And so I feel like the education system has to be revamped. The reason you and I are so good is repetition, reading, but that repetition, that pattern recognition. Here's AI that I personally think if you gave me AI when I was in medical school, I would learn quicker. I would get that patterns down, and I could learn quicker. And so 4 years, not to say that I don't need 4 years, but I would think I could learn a lot more in those 4 years and be better. The fun part, when I talk to some of my colleagues that are medical students, I'm like, how are you using AI? And they come up with all sorts of stuff. Again, it's a different age group. They're probably like 30 years younger than me. But what they're doing is kind of cool. They're extracting textbooks, they're uploading it to a GPT and then asking for summaries. They're taking those summaries and converting them into MP3 files. So then when they're driving to clinic, they're listening to those lectures. When they're doing their SOAP notes, they're asking for differential diagnosis, but they're asking AI. And then on stuff that they've never heard of, they're asking AI, is this, what is this? I've never heard of this disease. And then they can cross-reference with, a board certified doctor, like, hey, I never heard about this disease. What is it? And then they can see, so they're learning so much quicker. So I'm really stoked. I think big picture, we need to change as educators how we're teaching, not be so scared of like, do not use AI, it's cheating. And we got to convert that and say, no, you should be using AI, and let's explore your brain. Like, I don't want this rote memory thing. I want to know that you fully understand and you see the different examples and really take it out. One last example would be when I was in med school, if I was struggling, let's just say with, I don't know, renal cell carcinoma, to tell ChatGPT, tell me all the different ways that renal cell carcinoma presents, and then really just kind of play with it. I'm just fascinated by it.
Yeah, no, it's terrific. I think also I just want to underscore one point, that a lot of what we're talking about here, in terms of clinical applications, revolves around the speed to decision making, the accuracy, the pulling together of data, and very much focused in on one of your core strengths, which is the Chat GPT element of AI. I also want to underscore again the other components, which is this increased predictive value in endoscopy, in radiology, in pathology, which to some extent, some of these things are not really seen by physicians who are clinically practicing, but they're really looking at the reports. They're looking at the radiology reports, the pathology reports. And the extension of that really is into clinical trials now. So the ability to talk about how AI is going to improve the logistics of clinical trials. I can highlight one company that I know quite well, which is in silico medicine, looking at
Hmm.
the incredible speed in which they are bringing drugs to market. So, this ability to look at AI has several different components. One of them is the actual hands-on component, improving medical records, addressing burnout in healthcare providers, physicians, nurses, and other healthcare providers, improving the ability to make decisions, but also this flow of information from other subsectors within medicine, pathology, radiology, and diagnostics is going to be critical. And so the segue of this for me is, again, first education, and then second, even in the longer term frame, the shift from hospital to clinical practice to home. And
Hmm.
so I'm wondering if you see any of this shift, because the cost of healthcare is just not sustainable. It's astronomical currently in the United States. It's just out of control. More importantly, the control over one's own health status is now shifting into people's hands using AI. Apple is really a leader in this. Google is also quite involved in home care. So I want to talk about some specific use cases. Skin cancer, for example. The diagnostic capabilities of using some AI technology to empower patients to look at their bodies. How will physicians, in your opinion, relate to a patient who comes in and says, "Doctor, I got this AI result off of my Google and my Apple device. Give me a sense of," and this is pure speculation, how do you think physicians are going to respond to patients coming in with pertinent information? And I say this knowing full well that over the past 20 years, there's been a reformulation about how biopharmaceutical companies can advertise and the impact that advertising has on the psyche of
Hmm.
patients, and how patients then use that advertising and come, "Doctor, shouldn't I be on this medication?" So there
Hmm.
are parallels to that. And I'd love for you to comment about where that might go.
Yeah. Well, number one, the way I see it is we're reliving Dr. Google, but now it's Dr. GPT or Dr. ChatGPT or Dr. Some other AI model. And how to respond to that is tough because, if you don't, if a physician's not educated on AI, then they may be caught, off guard saying, wait, what are you talking about? I didn't even know you could do this. Or there's this thing is going so fast that that's almost embarrassing. In fact, I tell some of my colleagues, I'm like, hey, you really need to learn this really well because God forbid a patient can out AI you. Then all of a sudden they're not going to respect you as a doctor, and even though you have years of experience. And so, number one, I think we have to have the guardrails from an ethical point of view to kind of explain to patients that, hey, this isn't the holy grail. It's going to hallucinate. It's going to make mistakes. But with that said, in my heart, I really think I call it the healthcare IQ. I truly think that if we could average all the IQ in healthcare for the average person, I really think fast forward 5 years now, it's gonna AI is gonna push that IQ higher. My simple example is if I got a cigar out right now, started smoking in front of you, and you'd be like, "What the heck is this doctor doing smoking?" Fast forward 5 years from now, there are going to be things that you and I did today that we would not do 5 years from now because we didn't know that we can do that. I love your example of the pharmaceutical company. I had to go back to it real quick and say that some drugs have gone down by 90% because they can develop it so much cheaper now. And the reason I like talking about that to relate it back to the patient, if I have say, I'm going to make up something, say I had diabetes and I can use this technology, well, now I can personalize it and AI is going to help it where maybe I don't need such a high dose. Maybe I need a lower dose because it's going to be very specific to my genome, to my personal health. And so fast forward, I really think we're going to start now having digital twins. We're going to start having AI help us with cases that maybe it's you that you have an ailment, but then I'm testing it with different drugs with your digital twin, and then I come to you and say, "Hey, this is the drug that's going to be best for you now, based on your genetics and based on your digital twin."
Oh, absolutely. That I'm seeing in early stage companies is remarkable. We had an incredible company on last week called Avatar Medical, who's looking now at real-time molecular imaging. This ability to look at molecular movement in real time in 3D color video means that we can give patients an incredible opportunity to improve their surgical outcomes through advanced surgical planning. But also in the future, there's a high probability that this technology can be used in precision medicine by analyzing what individual drugs that we can create in a bespoke manner do for an individual patient, since we can see molecular movement. We can see, for example, a patient with a tumor given a specific drug that is precision derived for that patient based upon his or her genetic makeup. And then we can see in real time the effect of that on the tumor at a molecular level. So this is several years away, but it is, I think, a vision of things to come. It's a harbinger of the way that physicians are going to have to rethink how they approach patients. And that whole paradigm, I think, about what is the role of a physician, what is integrating this incredible technology in a physician's daily life, what is the role of hospitals to support this and department heads to support this. It's going to be a fascinating next decade. I am certainly thrilled to have you as a colleague who are spearheading so many interesting things. You're very modest. You started quite a number of companies. There's a number of books that you've written behind you. I think that it is an exciting time to collaborate with people like yourself, Harvey. And I very much thank you for spending the time today talking about these incredible things that you're seeing in the trenches.
Well, thank you so much for having me. And I actually look forward to working with you and your venture fund and actually become an investor. So thank you for your time.
It's my absolute pleasure. And I want to thank everyone today for tuning in. I just can't thank the audience enough for its incredible support over these past 10 months. And now we're looking forward to some exciting things happening in the fall and in the beginning of 2024. And just as a way of a bit of a harbinger of things to come, we do have this new collaboration with a number of different organizations. Part of that collaboration speaks to this cooperative effort between hospitals, physicians, investors, and enterprises like Microsoft. We will be featuring Microsoft on January 17th with Sally Ann Frank, who's the head of healthcare for startups at Microsoft. We'll also be featuring David Berger, who's the CEO of SUNY Downstate, the largest hospital chain in New York, who really is in the trenches every single day. The combination of these different perspectives, I think, is going to set the stage for an exciting 2024. I want to thank everyone again today for tuning in. And Harvey, you're welcome back anytime. I look forward to working with you at the end of this year and certainly into 2024.
Thank you so much. Honor to be here. And thank you, everyone, for watching.
Take care. Harvey, hang on for 1 second. I'm just going to sign off.